And now I'm going to open the sheath of the Foley catheter at one end. And at the other end. And now I'm going to take the inflation fluid, connect it to the balloon inflation port in order to test inflate the balloon of this catheter to make sure that it inflates correctly. And I use about 5 cc's because we found that some balloons leak or don't inflate properly or can even rupture, and you don't want this happening, obviously. And now I'm going to open the TUC safety valve, and you'll notice there's a red tab on it. You must pull the red tab off to make the valve workable. If you do not remove the tab, the valve will leak and won't operate properly. And now I'm connecting the inflation syringe to the female end of the TUC safety valve. The sterile drape underneath the penis or underneath the perineum. And of course, normally you punch a hole and put the penis through or expose the introital area, but for this demonstration purposes I'm going to do it like this. And now I'm going to take the anesthetic lubricating jelly, take off the top, and this is very important. I'm going to prime the syringe because, as you'll see, when you release the plunger there's a sudden squirt of gel. If you do that into a patient's urethra, they'll experience pain, and you don't want that to happen. I'm going to put the gel into the urethra, and in this case I'll just put a small amount, but normally you can use 5 to 10 cc's. I'm going to connect the TUC safety valve and the inflation syringe, and we've used blue fluid here just for the demonstration purposes. I also think it's a good idea to pre-connect your drainage bag, because then when you place the catheter you're not looking away looking for the drainage bag or the syringe or anything else, because when you do that the catheter can move out slightly and you come back to inflate the balloon and it's in the urethra. Now I place the catheter all the way into the bladder, generally speaking up to the hilt. You wait for a flow of urine into the bag, and then you know you're in the correct position. And then you inflate the balloon through the TUC safety valve. The balloon inflates within the bladder. It takes about 10 seconds longer than usual to inflate, and that's part of the way the valve works. Don't be surprised at this. And now the balloon is fully inflated, and important to disconnect both the TUC and the syringe at the same time, because if you leave the TUC on, fluid can escape and the balloon can deflate. And now with the catheter incorrectly placed in the urethra, so that the balloon is actually in the urethra, when I depress the syringe, a tiny amount of fluid goes in, and now the valve leaks. First drop, stop is what we say. So that tells you that the balloon is inflated in the wrong place. It's in the urethra. The valve protects the urethra and it tells you to stop, that you're in the wrong place. You aspirate what will just be a tiny amount of fluid. That's all that's needed generally. Reposition the catheter. And now we re-inflate the balloon with no leakage from the valve. And again, you'll notice it takes a little more pressure and takes a little longer to inflate than normal. This is what you expect with the safety valve. That's how it works. So very important is to detach the TUC and the syringe at the same time. If you detach the syringe and leave the TUC in place, it's a two-way valve, so leakage can occur from the balloon.